Your support helps us bring you programs you love. Go to wyomingpbs.org, click on Support, and become a sustaining member or an annual member. It's easy and secure. Thank you.
The statistics are sobering. On average, every third day, someone commits suicide in Wyoming. It's not a new problem, but there is hope. Tonight, we'll hear from 2 suicide survivors. A note to our viewers, their stories are powerful and the content may be disturbing. We'll follow with a panel of experts determined to understand and help with the problem of suicide in Wyoming. We're learning that in order to make a difference, this problem must be discussed. Throughout the broadcast, we'll display the 24-hour National Suicide Prevention Lifeline phone number. If you or anyone you know is contemplating suicide, call that number now.
My son took his life on March 29th, 2006, when he was 17 years old. I should have seen it coming, and I didn't. Or maybe I did, and I didn't know what to do. That might be the better way to put it. He was having troubles. He was acting up a lot more. He was more reckless. He was more angry. He was really struggling with life. And I so wish he could have come to me and said, "Dad, these are the things that are kicking my rear right now."
I'm Rihanna Brand, and this is my story. I was sexually abused for 4 years of my life. The first time I can remember was when I was 6 years old. Maybe left me feeling lost, abused, used, worn, not lovable. The first time I attempted suicide was when I was 9 years old. I took a pair of windbreaker pants, wrapped it around my neck, and pulled as tightly as I could.
It was a sunny spring day in March, 70-some degrees. It was a day where he should have been in school. He wasn't. He went to school that morning, came home early. My wife came home from working at the library, volunteering at the library that day, and she found his car. His car was at home, and she was used to him missing some classes. So she came in the house and she yelled down the stairs. His room was in our basement. She yelled down the stairs just to tell him she was home. And there was no answer.
The best way it's been described to me is looking through a straw. And at the end, all you can see is what's going to help you through that pain at the moment. And right then it was pills. I ingested over 1,000 ibuprofen that night and whatever other pills that I could get my hands on. And I remember the moment that I started to get a little out of it, I called my dad and I whispered to him, "Daddy, I don't want to die." And the next thing I remember is waking up in the hospital. They had given me charcoal and shoved something in my nose, and it was the most god-awful experience. But I can remember thinking, thank God I didn't go through with it.
And my wife went back to working around the house when she started thinking more and more about the fact that the door wouldn't open all the way. And she said, his room was somewhat messy, but it was never so messy you couldn't get in. So she forced the door open and found him that he'd hung himself in his closet, and the closet was right next to the door to his room, so it was his body that was actually keeping the door from opening all the way. She got him down, dialed 911, called our daughter, and called me. And our lives changed that day, and it's never been the same.
It was a few years later that I realized that what I needed wasn't going to be anything that was outside of me, but it was something from within. Through all of that, I just wanted love. That was my biggest fear in life, was to never be loved. I was a burden on people, and I was so worn and abused that who could love me, you know?
But I would like people to become educated in what are the risk factors, what are the options within my community. Yes, I may not be able to take care of everything and solve any of the problems myself, but where can I go for assistance? And one of the biggest things that we're teaching within the state right now with a program called QPR, which is question, persuade, and refer, is to get people to ask the question. You know, I'm concerned about you, I see these problems in your life, and I want to help. Are you thinking of taking your life? Are you thinking of suicide?
For someone who has contemplated suicide, my advice to you is to reach out for help. You are not alone. You can either call the Suicide Lifeline or contact someone in your support system. There has to be at least one person in your life that would do anything for you. Tell them the truth. Tell them that you're thinking about harming yourself. Tell them that you're thinking about killing yourself. It's not something to be ashamed about. People live with that every day, and people fight that battle every day.
We've just seen two very powerful stories about suicide and its impact right here in the state of Wyoming. We feel that it's an important issue to be discussed, and we've assembled a panel here today to talk about the issue of suicide in Wyoming. Joining me is Reverend Dr. Bernadine Craft, Chair of the Episcopal Suicide Prevention Connection. She also represents Senate District 12 in the Wyoming Legislature. Senator Craft, welcome.
Thank you so much.
Dr. Terresa Humphries-Wadsworth is the Director of Statewide Suicide Prevention for the Prevention Management Organization of Wyoming. Dr. Humphries-Wadsworth, welcome.
Thank you for having me.
And Dr. Carolyn Pepper. She's a professor in the Department of Psychology at the University of Wyoming. Dr. Pepper, welcome to Wyoming Chronicle. Dr. Pepper, I want to start with you. Define the problem for us here in Wyoming.
So Wyoming is frequently the #1 state in the nation in terms of numbers of suicides. The years that we are not #1, we're still in the top 3 or 4. And the states that are around us, like Montana and Idaho and Alaska, are also states that have high rates of suicide. We used to think that when you looked at these states, we think of the cowboy who might commit suicide, the kind of middle-aged white man in a rural area. And as I've been looking at the data, it looks like what we see in the Mountain West is high rates of suicide for men, but also for women, across different racial groups, not just for whites, and for all different age groups, from the very young to the very old, and maybe even most surprising, across all different levels of urbanization. So in very rural areas, including and up to very urban areas, like our cities like Denver and Salt Lake City. And when you look at all these together and what might be causing the high rates of suicide in the Mountain West, there have been several different explanations proposed. One is that it might be something to do with the altitude out here. But another thought is that it's something to do with what I hear people say around the state, that we have this pull yourself up by your bootstraps mentality, this stoicism that makes it hard for people to ask for help. And that could be a real factor in driving the suicide rates here.
Reverend Craft, the Episcopal Church has decided to take this on as an issue. What's the genesis of that thought, and what is the Episcopal Church trying to do relative to suicide?
We have the genesis. Actually, I need to give full credit to our bishop, the Right Reverend John Smiley, who recognized the problem in Wyoming and said, we can't just talk about it. We have to do something about it. So he commissioned a task force that morphed into the Episcopal Suicide Prevention Connection with the idea of addressing the problem by providing opportunities for training, materials, resources. We're very big on partnerships, so we happen to be partnered with PMO because they can provide wonderful training opportunities throughout the state. What we hope to do, and what we've been successful in doing the past couple of years, is being able to reach out to our clergy people, because especially in some of the very small, very rural areas of the state, we tend to tell our clergy, if someone comes with an issue such as I'm suicidal, we tell them to seek professional help. We'll call your professional. Frequently, they're the professional. They're the only one there, and we want them to have the adequate training, resources, and materials necessary. So we've been trying to provide that. We have been trying to provide resources statewide on our website and by going out into the communities. We're also partnered with the Episcopal Diocese Foundation, and through that, we're able to provide grants to individual communities to do projects that work well for that particular community. So far, we've done a very successful postvention training in Gillette, in Campbell County, with what do you do after a suicide has occurred. And we're excited to kick a new one off in Albany County. Both of them are in partnership with Prevention Management Organization. So we're trying to get really down into the trenches and reach people who can reach the people on the ground, because we really believe awareness and being able to understand that problem and deal with it effectively on the ground is an answer.
I want to just mention to our viewers that throughout this broadcast, there is a number on the bottom of your screen to the National Suicide Prevention Helpline. And we'll talk more about its availability for people who might be impacted with the issue right now. But Dr. Humphries-Wadsworth, I want to ask you, you have a tall task. You're the statewide director of suicide prevention in one of the states with the worst problem.
Right.
Tell us what you do and what differences do you think you're making?
Thank you. Our organization works in communities in every county in Wyoming. So we have prevention specialists who are working with their local coalitions and their local groups who are interested in healthcare, in healthier, safer communities. So they're looking for ways within their community to save lives. Part of their task is suicide prevention. So we work with them to train people in how do you recognize the warning signs when someone's at risk, and then what do you do once you recognize those signs? And what are the local resources? And how can we be creative, like the diocese is stepping up, being creative to meet the need in every community across Wyoming. The Wyoming Suicide Prevention Advisory Council is a statewide council, and they set the state plan for suicide prevention. And part of that plan, one piece of it, is about training. And they set the goal of training 10% of the adults in Wyoming in suicide prevention. And we're at 8%. That's 1 in 12 people have been trained in suicide prevention. That's immense saturation, but it's not enough. There's much more we need to do.
Dr. Pepper, you approach this from an academic perspective. What is the relationship between the training that Dr. Humphries-Wadsworth talks about and impact, a positive impact on the problem?
We have data now that trainings that reach particularly people who are gatekeepers, people who might encounter people in distress, whether those are physicians or teachers or professors at the university. If you provide training for those people, you can actually lower suicide rates in a state or a community.
So Dr. Craft, then the question begs, is Wyoming doing enough? Are there concerns that Wyoming, relative to mental health funding perhaps, needs to do more to impact this problem? Is this a problem that will go away without funding?
It's a problem that's never going to go away, unfortunately, and we're making great strides. I'm very excited at that 8 out of every 10 that we wanted to train. I'm excited about that. It's never enough. And maybe I should take my collar off for a minute and put my legislative badge on for a minute and speak as a member of the Senate. And at this particular point in time, when we are seeing an economic downturn and we're worried about our resources, we're worried about the decline in oil and gas specifically, this is exactly the time that I think we need to be aware of continuing funding and hopefully improving it for suicide prevention and awareness activities. One of the groups that we reach are people in the schools, the school personnel, and that's because in 2013 we did pass passed the Jason Flatt Act. Wyoming was the 13th state in the nation that did that, and it makes mandatory training for all school personnel, teachers, administrators, support staff, to have at least 2 hours of training in awareness and prevention. We're not trying to make little baby counselors out of these people. We're trying to get them to recognize the signs and then to, as Dr. Humphries-Wadsworth said, know what to do when that happens. The House, when we did that particular piece of legislation, put an interesting amendment on it, a good one. They said that all those trainings shouldn't just be for the teachers and for school personnel. They needed to be open to the public. So they needed to be advertised, and if anybody in that community wanted to go, they should be welcome, which I thought was wonderful. I'd like to see us do more in that area. I think Wyoming's most precious resource are our people, are our citizens. And I think at this particular time we need to be very aware that funding for mental health, behavioral health, mental health parity, all of those issues are hand in hand with suicide prevention and awareness. So I'm really hoping that when I join my colleagues for what I'm sure will be a very interesting budget session in February, we don't lose sight of this incredibly important.
Dr. Humphries-Wadsworth, it's interesting to me that training is required of teachers and administrators, but not of primary care physicians, not of police or even hospital ER workers. How important is that training for them? And I guess, are you just suggesting they take advantage of it now, or how are you trying to communicate to those on the front lines?
We've identified that those gatekeepers, like Dr. Pepper mentioned, are so important to be able to brush up their training that they got in graduate school, whether that's physicians or nurses or mental health counselors. They all were exposed to it, but that may have been a year ago, it may have been 10 years ago, it may have been a very long time ago. And if they haven't had brush up training, it's not going to be front of mind, and they're less likely to recognize the symptoms when they're in front of them. So we're encouraging mental health providers and physicians and nurses to take the free trainings that are offered to them and made available both online and in person.
But certainly now there might be people that are watching this right now that are concerned about their spouse, yes, their parents, their children, their friends. What should those people do right now? What is the best way to handle the situation?
Well, if you're concerned about someone that you care about and have a relationship with, go talk to them and tell them your concern. Describe it, and use the very uncomfortable phrase of, are you thinking about taking your own life? Are you thinking about suicide? Saying it that blatantly, putting it out on the table, says two things. One, I can say it and I can handle it if you tell me yes. And if you say no, okay, then we'll address what really is going on. But if they say yes, then you listen to what brought them to that place. And once you've listened to their story, you get them connected with professionals, whether it's your clergy member, whether it's a mental health counselor, whether it's the emergency room, whether it's calling 911 because you don't know what else to do. Any of those options about helping that person get linked to good care and staying with them and being part of their recovery and their healing, because recovery is possible. When someone reaches out for help and they receive compassionate care and their family's involved, their chances of recovery are so much higher than if they're left on their own to figure it out.
So there are myths then that are out there about suicide. Dr. Pepper, what are those myths? What are just issues that simply aren't true?
One myth is that suicide can't be prevented. People sometimes think that if someone wants to kill themselves, they will find a way. And in fact, we know that there are lots of things that can be done in many cases to prevent suicide. So listening and referring to good treatment is one way to reduce those suicides.
I want to talk about something that Mr. Nyberger told us earlier today when we visited with him. His story is a powerful one. He had his child visit with the therapist about a different issue, about depression or bipolar disorder. But the child learned to play the therapist game. He reported to us. How can parents or spouses or children of parents get the right help in Wyoming? And certainly, I would assume that there's a difference in the help that's available in different counties, in different cities. What's your advice to parents or to anyone who isn't getting the benefit that they need to get right now, today? Anyone?
Be persistent. You know, finding a good match with a therapist is very important, and being able to be involved in your children's care is very important. I mean, that's 1 hour a week, many times, that a therapist sits down with a client, but the family's with them all the rest of this time. And they need to know how to help that child the other 23 hours of that day and the other 6 out of 7 days of that week. So involving them in how they can increase the resiliency and coping skills for that child, how they can take protective measures at home, what are the things the parents need to be looking out for. All of those are very important in wrapping care around children.
And I would really agree with that, and communication. Communication with not only your child or whoever it is you're thinking, but the people that are involved. I spent a lot of years working as a school counselor at a lot of different levels, and we found sometimes some of the most effective therapists were the bus driver, the lunch lady, whoever that person can develop a relationship with, which is why I think it's so important that we provide this fundamental basic training of recognizing the warning signs and knowing what to do to everybody we possibly can, because it's not always going to be a licensed mental health professional that person reaches out to. It may be a neighbor, it may be someone sitting next to you, it may be a classmate, and that's where I really think we need to be so aware that we can have anybody out there ready to make that call and ready to access those services.
Dr. Pepper, I want to ask you, can it ever be a mistake, to do as Dr. Humphries-Wadsworth suggested and ask someone if they are considering taking their own life?
No. Asking the question never directly causes a suicide. And it can lead to such a useful conversation about what's going on with that person. What kind of situation are they in, and how can you even help as a friend just by being someone to listen?
So we've touched on the Jason Flatt Act, but there are other things going on in the state of Wyoming. Dr. Terresa Humphries-Wadsworth?
Thank you. Recently, the governor has put out a request for all government employees to go through suicide prevention training. This is landmark. It has it's unprecedented that there is an opportunity for every government employee to go through suicide prevention training. That's a lot of people in Wyoming. And the Department of Health has said, yep, we're stepping up. All of our people should go through this training, and it's online and it's available. It's Question, Persuade, Refer, or QPR. It's a basic training, takes about an hour and a half to go through, and it teaches those basic skills of asking the question, helping the person decide to go get help, and then helping them refer to someone local, and making sure that that training is available. So our government has stepped up, and they are taking the lead. Additionally, we're seeing some of the energy industry stepping up and making this same training, this QPR, part of their annual training, just like getting your hands washed or going through any of those annual trainings that people have to go through, safety and wellness training. So up in Campbell County, a number of the energy industry has stepped up, and they are doing that. And
if people, employers or others, want to take advantage of this for the people they employ or the people that they're responsible for, how can they affect that within their own organization?
We'd be happy to help them set that up. There are a number of training certification classes, so they can have their own internal trainer if they want, or we can come and do those trainings. So the PMO is available to do that. And that is our mission, is to work directly with our organizations on a community level to help meet those needs.
Each of you have taken an interest in this issue, and I want to go around the room. Why is this issue important to you? Dr. Craft, let's start with you.
Started out as a school counselor, and that was one of the worst tragedies that could occur.
It happened in your school?
And it happened in my school, and it was tragic. And what was not only tragic was the loss of the young life that could have been prevented, but then unfortunately, especially with adolescents, we see copycatting. And I think that is one thing we need to be very cautious of, especially with our young people, is not glamorizing it and not making it seem like this beautiful way to make sure everybody loves you and gives you the recognition you deserve, that it is ending your life. And so that initially started out. And then when I began my process through the steps to become an Episcopal priest, I recognized that we as the faith community need to be providing what we can provide, which is hope, love, and acceptance, and reaching out to all of those people. And as a senator, I believe, as I mentioned earlier, our most important resource are our citizens, and to provide these most basic resources to bring that suicide rate down as far as we possibly can. Even one suicide is unacceptable.
Dr. Humphries-Wadsworth, why?
Wow, that's kind of a long story. I've been a clinician for a very long time, working with people who are at high risk. And I, like many other mental health providers, had training in graduate school. I got some on-the-job training, but I'd really never been through specific suicide prevention assessment and management training. And I encountered a patient who was very high risk, and he died. It was not ruled a suicide, but the question was always lingering in my mind, was it really a suicide? So I went back and got a lot more training. I discovered some things that on the job I didn't know, and I had to go back and learn a lot about it. So I began taking that information and applying it in our clinical practice and sharing it with my colleagues, and then having an opportunity to share that information on a broader scale and becoming a suicidologist.
Dr. Pepper, I'm sorry.
I've been interested as a clinical psychologist in issues having to do with depression, having to do with self-injury, having to do with psychological pain. And when I moved to Wyoming and found our high rate of suicide here, it seemed like a natural extension of my research work. So my interest has been largely academic, but I think it's because it's such an important thing to learn more about.
It's worth noting that everyone who attempts suicide does not commit suicide. And families of those who do commit suicide also are survivors. What's our advice to those folks who find themselves in that position right now? How can they best be supported to cope with a tragic situation?
Suicide remains still a struggle for people. They don't know how to approach this unique kind of grief, apart from if their child or a family member had died by some other way. I think that's why the leadership from the Episcopal Diocese is so incredible. The faith community stepping up and saying, we have a role in this. We have a role to provide comfort and hope and acceptance for not only the person who's struggling, but the family who ends up being left behind, that they're not going to be separated from their faith because of this act. I encourage people surrounding this family to continue to reach out, to talk about the person who died, to continue to support and care about them. For people who want more support, there's a number of resources online. They can call the suicide hotline as well. They don't have to be in an acute suicide crisis. They can be a survivor and need someone to talk to. The helpline's there for that as well.
My experience has been exactly that, but there's a tremendous sense of guilt. There's a tremendous sense of, I should have seen the signs. I should have known.
I want to talk about that real quickly.
Yeah.
For those who are thinking, well, this doesn't impact me, what should we be looking for? What might we not be seeing in our last minute or so of conversation?
I would say the thing to be looking for is things like depression. We know that 90% of people who have taken their life by suicide had some sort of behavioral mental health issue, and most often that's depression. So people who seem sad, who seem less engaged with the world than they used to be, maybe they aren't spending as much time with their family and friends, those are the people to reach out to.
And I would say sometimes in adolescent boys or young men, it may come out more as anger than in the sad or apathetical approach. So any kind of mood change, dramatic mood change from normal, is something to pay attention to.
And I think we have to remember that it doesn't need to be a great, big, huge problem. Because if it's a great, big, huge problem in that person's mind, then it is. So I think we need to look for the affect in the person and not, oh, gee, this terrible thing happened. It might be something like my boyfriend broke up with me, which we say, oh, gee. But that's an incredible experience for that person. So I think being very aware of that, very aware of when you see people getting into that hopeless and helpless. It's never going to get any better, and there's nothing I can do.
But the takeaway today is don't be afraid to ask someone if they're contemplating suicide, and not to be afraid to use that word. Reverend Dr. Craft, Dr. Terresa Humphries-Wadsworth, and Dr. Pepper, thank you so much for joining us on Wyoming Chronicle.
Oh, thank you so much.